Clinical research is a process by which you participate in a study that is designed to answer specific questions. And this involves all of the medications that have been approved by the Food and Drug Administration to be used by a physician or to be prescribed by a physician. And it also includes other types of treatments, such as different types of surgeries potentially, different types of devices that may be implanted, say like a defibrillator that you actually may have. And without the participation of individuals, such as yourself, that we couldn't do those kind of studies. And we wouldn't have all those medications that are available for treatment for common conditions such as high cholesterol to more advanced types of treatments for advanced cancer, etc.
I've done clinical research for 40 years at UCSD, and I'm an older person who's very interested in healthy aging. And so therefore I'm interested in the participation of older people like myself who could be in clinical trials.
Personally, for me, the program, what it has contributed has been power. The power to not be afraid of diabetes.
I know when my wife was first diagnosed with multiple sclerosis, there was not one medicine that they had for multiple sclerosis. Now there's a number of new medicines, and they're coming up with new medicine every day. And all of this was developed through clinical research.
I was diagnosed with breast cancer a year ago, and there's a medication out there that when it wasn't available 10 or 11 years ago, and now it's available, and if it hadn't gone through clinical trials, that medication would not be available. So, and it saved my life.
There are two different types of studies. One is an observational study where nothing is really done to you as a participant. But the other type of research study is a clinical trial, and we think of this as an experiment. We have to place you as a participant in one of two study arms. And one of them may be taking the medication, and one of them may be taking a placebo, which is like a sugar pill or something that doesn't have any effect. It could be an intervention where we ask you to make a certain behavior change, and another group maybe just seeing their doctor as they usually would, what we call usual care or standard of care. This process of allocating individuals to one group or the other is done randomly, and it's very important that we do it randomly because it has certain beneficial effects on the study and the ability to find valid results from the study.
There is a possibility that I'm on a placebo. I do not know that for a fact.
Once you understand its reason, you really have to compare the people who were assigned at random to treatment X or to without treatment X. You have to understand that that's the only way we can answer this question.
Research projects usually have a somewhat of a focus, and in that focus may be certain criteria which you would need to qualify to be eligible. And it's nothing personal, it's just that the research question is focused on that group specifically. But we hope that that doesn't discourage you from participating in other research that may be going on at the university or elsewhere if you find it interesting to you and think it would be something you want to do.
When I went into the study, I was anticipating, you know, continuing until the end of it. But I didn't quite qualify, and I was a little disappointed, but not to the point of, oh, I'll never go into another clinical trial. No, it was just this one.
In order to qualify for the program, you had to be in a certain range on your blood sugar, so there was blood tests that were taken, and then you were given the results of the blood test and whether you qualified for the study or not.
The main thing is that we are doing studies almost every week. We started, someone at this university is starting a new study in a totally different area. We actually will probably ask you, if you're not eligible for this study, if we can have your permission to keep your name on a list so we could call you for another study.
As an investigator, I have found that people go into research for a lot of different reasons.
And one day I received a postcard, and there's diabetes in my family, so I decided if I became involved in the study would help me.
My wife and I were sitting at the dinner table, and we were going through our mail, and I saw this card says T-trial. So I read a little farther, and it said testosterone. I gave it to my wife. I says, "What do you think of this?"
There was a friend that talked to me about a program through the university, which was for what they call diabetic prevention program. I haven't had a mother who was diabetic. I realized that unless I took control and I learned how to manage this disease better, I was certainly going to follow my mother's steps, if not worse.
If you have questions that are related to the study or not, someone will call you back, someone will reassure you, someone will do whatever is appropriate.
There's a wide variety of clinical research studies that are offered typically, some of which are quite short. For instance, there are studies that want to look at the effect of an intervention or taking a medication for a very short period of time, maybe a few weeks. And then there's other studies that go on for many, many years, and those are typically more of the what we call observational studies, what we talked about before. We want to observe what happens to people over time. So you as a participant, a research participant, once you enroll, are not bound to remain in the study for the entirety of that study. So even if the study is 1 year, after 2 weeks you say, this is really not what I planned on, what I anticipated, you can leave the study at that time.
You're not committed like a dotted line, like, oh, well, you signed it, so you have to do a year, you have to do 6 months. No, it's a volunteer thing.
You were randomized, and I ended up in a medication part. I could have opted out, and I knew that there would be benefits to being in the study, so I made the commitment to stay.
It's important that you as a potential research subject feel comfortable enrolling in any clinical trial that you're considering. And I think the first step is to contact the site and get as much information as you can over the phone. And they'll probably do this when they contact you to recruit you. Ask questions. And then once you have that information, you can share that information with your private physician if you'd like, and he can counsel you on what he believes to be the best course of action. And then the third would be to consider obtaining information about whether the study has received approval from the Institutional Review Board. This is called the IRB. And this is, again, required of all research studies that involve people. So if the study that you're considering has not received approval from this board, this IRB, then you may want to consider being cautious about those kinds of studies.
A well-done trial has a university-specific informed consent group that look at the study design, and they decide whether the study is safe, as safe as we can hope it to be, whether it's been ethically designed, and specifically whether you know what you're getting into. So that's what's called an informed consent.
After going in and talking to the doctor, the nurse, they put my mind at ease, and now I have no anxiety about going in.
Everyone has their own motivations for participating in research, but I think a general concept would be that most of them want to do something for society. They want the information to be for their grandchildren or their children so they can benefit from whatever is found in their research.
People that have been in at least the trials that I've been doing are doing it because they want the answers for the next generation of people.
Our medicine from back in the days when I was young until now has made leaps and bounds, and most all of it is come from clinical research. So I think we all should get involved some way or other.
You know, I think about like my grandchildren and future generations, that what we're doing now in this study will help them.
It's kind of like I put a grain of sand on that beach to make a big beach.
For the seniors, try clinical trials, spread the word, because it's out there for you. And we need to get more involved. And it feels good to know you're giving back.
Get involved. For more information, contact your local research university or visit researchmatch.org.